This is Dr. Timothy Scott Beck here, talking to you this morning, coming from LifePoint Medical. It is October the 9th of 2023, and I want to thank you first for listening to me, and I want to go ahead and get to business and talk about some things. First of all, let's talk about a medical issue that I'm kind of seeing an uptick in right now, and that's fractures of the bones. I'm seeing lots and lots of people coming in with fractures. I think I know of at least 4 or 5 over the last week, different age ranges, but it leads me to the discussion about osteoporosis. And osteoporosis is the degradation of your bones, the calcium in your bones, the strength in your bones as we age. Okay, and we all lose a little bit of bone mass as we get older. That's a normal thing. Okay, but what we got to do is we got to find out who's doing it abnormally, and we treat it respectively. And osteoporosis is much more prevalent in women than it is men, it probably has to do with hormones, and I'll get into that just a little bit. But the way we test it is we go and get a bone densitometry, where we look at 2 different places on your body, and we determine whether or not your bone density is appropriate based on a 28-year-old person is what we do. We actually base it on when your bone density was the highest, which is about the age of 28. So we compare your current bone density with what it was or should be at 28 years old, and we treat that accordingly, because the T-score, which is what we go off of there, indicates to us who is at increased risk for fractures. And when you fall, and you have a low bone density, you're at increased risk for fractures. But your bone density gets so low that you'll have a fracture and then fall for some people. So this is something that we try to go over on our wellnesses every year. We try to keep up with people, and we try to do them certainly after they've had a fracture. So if you feel like we haven't done that, or you need one or want one, come in and see us, and we'll get you set up for one and tell you all about it. I think it's a very useful tool. I do believe I've helped some people by treating osteoporosis, and we just got to keep our eye on it. It's just one of those things that creeps up on us, and we have to do it. And we try to go over it annually in your wellness. Now, if we find out that you do have osteoporosis, we treat it with oral medication to begin with, but there's also injections, and those are hard medications to get people to take. I do think they're effective, and a lot of times they're expensive and things like that. So it is a little bit of work to get people on the right medicines, but I'm not afraid to do it, and I think it's useful. Interestingly, we offer the hormone replacement therapy here in our office, which helps tremendously with the osteoporosis. So if you are on hormone replacement therapy from us, you can be reassured that is helping tremendously with your osteoporosis. So that's a little clinical pearl on that. Another thing I was reading this weekend was talking about running and depression. And I've known this for a long time. I've been preaching this one for a while. I get lots of people who come in with anxiety and depression. And I try to always tell them, say, look, sweat is one of your best treatments for depression and anxiety, and it really is. And the news article I saw this weekend, where it recommends that if you run 2 to 3 times a week, that's equivalent to the medicine we give you, the antidepressants you give you. And I agree with that. I ran my butt off in medical school. I ran through residency. I still run to this day quite frequently, and it absolutely, unequivocally helps with my mental health, with my anxiety. It does. It really does. And there ain't no way to explain it. And I know some people can't get out there and do that, but for most people, if you're feeling overly anxious or you're having a lot of anxiety and depression, get outside, work it out. Just don't injure yourself. And I always tell people, as a human being, we're really prepared for much more stressful lives than we're actually living nowadays. I mean, we got a lot of mental stress, but a lot of the stress that people had to deal with 100 years ago is non-existent now. People dying of unknown causes, people not being able to get medicines for whatever, or having to live with whatever the thing was, whatever your disease is. And I know here, even Rabin County, a lot of these mental disorders was treated with alcohol 100 years ago, which is a terrible drug to treat for mental illness, for depression or anything. It just makes it 10 times worse. So I couldn't imagine, don't want to imagine. But anyway, exercise and running is a great little way to mediate your mental health. If you can't run, walking, taking long walks for like an hour, I know those help too. I don't think they help as good as the running, but I do think it helps. Okay, so just a little pearl there. It also, well, we don't use exercise as a weight loss strategy anymore because we know exercise makes you healthier, okay, but if you're looking at numbers and weight loss, we really don't see it unless you're extreme, and most people can't do that much exercising in a period of time without getting some kind of injury. But while we're on the weight thing, I wanted to let you know that the semaglutide, it's kind of neat now. I'm getting to see people in the community, and usually I'm just looking around and taking in my environment. But I'm noticing that there's some people that are on the semaglutide who look much thinner and have had great success with the semaglutide program we have here. It's exciting to see that people are losing weight on this. Now, an interesting phenomenon happened last week. There was an article out, where Walmart was complaining about this new semaglutide because it's cut into their grocery store business. Like they're selling less groceries because people are eating less. And I'm like, hallelujah, what a blessing that is to hear about that. So just a funny little thing, if something's happening if Walmart's selling less food. So keep it up. That's great. Hopefully we'll cut back so much that there's enough for everybody. All right. So that's all I was wanting to talk to y'all about today. It's a beautiful week. I had a beautiful weekend. It's a great time. We know Rabin County is a magical place in October. I swear. It's a beautiful place on earth. So I love being here during this time of year. Certainly it's cooler, and that feels good too. Maybe we'll get that fire started here shortly. But anyway, if you need us, if you're sick or you feel like something's off on you, or we can do a better job at doing something, we want to hear from you. We're going to be trying. We're going to try to get you taken care of and do the best we can. I promise you, we're not perfect, okay? But I think we're perfect at giving it everything we got to try to get it as right as we can, okay? We got a lot of new employees here, a lot of new nurses that are being trained up and are being let out. So I do ask that you be cooperative with us. We're having a little bit of growing pains with the new staff members. We get some scheduling issues at times. We're having, staff issues figuring out how to do things, but these are just minor things that we're getting through, and we're going to, this new crew that I'm working up here, they're going to do a great job, and I've got some real talent here. Some really smart people have come on board, so I'm really excited about that. So anyway, our number is 706-782-0016. I got 5 people answering the phones this morning. So if you need us, you give us a call, and we'll be more than happy to get you set up so you can be seen and get taken care of. Thank you so much. Have a great day. Call us if you need us.